Good morning. Thank you for joining us today. My name is Joanne Farrar, the Marketing Director at Dymedso, and I will be your host for today's webinar. We will discuss the different use cases of the Dymedso Frequencer. Today's speakers include Marcin Madej, a senior physical therapist at New York Columbia and New York Presbyterian Morgan Stanley Children's Hospital, and Michael Mendez, respiratory therapist and clinical specialist from Sovereign Medical. We reserve time at the end of today's discussion for a Q&A, so please submit your questions at any time during the discussion and we'll address them during that session. And now it's my pleasure to turn it over to Marcin.
Okay, thank you, Joanne, and thank you, Michael. I would like to welcome everybody to our webinar. So today we will be discussing the clinical application of the Dymedso Frequencer for airway clearance in the acute care setting. So what is the frequencer? Frequencer utilizes sound in order to decrease mucus viscoelasticity so that we could perform airway clearance for our patients. Now, sound can be very powerful, but yet gentle at the same time. That's why I utilize the images on the left to show how sound can actually cause water to levitate, which that is actual levitation of objects. Here we have on the right a Chladni plate, which uses vibrations from sound to move matter. And depending on the frequency, as you can see, it changes shape, the sand. And thirdly, you can see, of course, how a speaker and its sound has an effect on water, so cymatics. So again, the frequencer generates sound in order to break down the mucus for airway clearance. The device itself has a touch screen. It utilizes positioning from going from lower lobes to middle lobes to upper lobes, different size heads, and a portable monitor. Overall, the unit itself is small and can be easily fit into an IC room. And the change of the head, it can stay in a patient's room, depending on the one that we use. So the current therapies that we utilize in the hospital are manual chest PT, vest therapy, small oscillatory PEP devices such as an Acapella or Aerobica, bubble PEP, of course, coughing, breathing exercises, and exercise itself, mobilizing patients, and the frequencer. However, out of all of these, there are contraindications. I cannot utilize most of these devices, specifically manual chest PT and the vest in the hospital for certain conditions with our critically ill patients. And that's where the frequencer really shines and we can utilize it. So here I created this a list of the biggie components of the frequencer, specifically when patients have thrombocytopenia. When the platelet count is under 30,000 patients, we cannot perform manual chest PT or put on a vest on the patient because, of course, the potential risk of bleeding or bruising. That is a huge contraindication for those devices and a limiting factor for them. Secondly, rib fractures. Also, with patients with cystic fibrosis tend to have fractures due to the intense coughing and, of course, due to the meds that they're on, causing their bones to be more brittle. They do experience fractures that we often find, and then I cannot perform manual chest PT or use the vest, or I will have to set such low settings that it's really not effective. Moving on to from the fractures, which are of course painful, pain in general. Patients can sometimes be overly sensitive. We have many admissions with patients with cystic fibrosis who have oversensitivity to pain. Any type of touch, gentle touch even, can be painful. So how can I put a vest on someone like this or perform manual chest PT? Then I'm really limited to the components that I can perform with these patients. That's where the frequencer shines because it does not cause that sheer force. It utilizes very directed sound waves, which are gentle, but yet at the same time highly effective in order to break down the mucus. Also incorporating the pain component, we can talk about post-surgical patients. And now literally the whole post-surgical list of surgeries opens up. Patients after coronary artery bypass graft, transplanted patients, patients with a liver transplant with the large staples around their abdomen, a lot of pain to even simple movement, as well as being attached to a plethora of tubes, lines, devices, life-sustaining devices. Sometimes some patients after a heart transplant might still have to be on ECMO. So we cannot strap the vest onto these patients. And performing manual chest PT is extremely tricky because you're trying to find that area of skin that is free of all those lines and tubes. And sometimes it is very limited to the point where it's maybe 1 or 2 positions and that's it. I cannot officially affect the entire lung. That's again where the frequencer comes in, because depending on the size head I use, I can really get in between those tubes and direct the sound specifically to the lobes that I'm trying to clear and open up if there's atelectasis. On the 5th point, again, that is sort of moved in with what I was trying to say too, those multiple lines. And finally, small bodies. So patients in NICU, they're very sensitive to external factors such as sound, light, temperature. Bringing in a device in there that shakes them. First of all, there is no vest of such small size to work on patients in the NICU. So it really leaves us with manual chest PT or use of other devices. But what the issue is that is a stressing factor. I have to perform manual chest PT at a certain force in order to be effective. Otherwise, it really is not doing its job. That's where, again, the frequencer comes in, because it is able to use these gentle sound waves, which at the same time are very effective. The decibel reading from this machine is pretty low, and the sound that it generates is actually rather soothing. So it soothes a lot of our patients in the NICU. So rather than creating more negative factors for these patients who are so sensitive when they're micropreemies, preemies of 27 weeks, etc., this device itself is very soothing. So that's the niche of where the frequencer really focuses in, where I cannot use other devices. But at the same time, despite that niche, the frequencer has a multi-use component. So I could use the frequencer with pretty much all the other conditions where we use manual chest PT, vest, portable PEP devices, etc. So every other condition where I would have used those devices, I can also use the frequencer. So it has the niche, but it at the same time still keeps the multi-use. We've bolded here some of the conditions to really point out some big ones here, but I will soon go into a few more details. But the big ones, of course, being cystic fibrosis, bronchiectasis. Now we're in the flu season, so a lot of kids coming into the hospital with RSV, rhinoentero, requiring airway clearance. And again, I tend to reach for the frequencer because it's so effective but gentle. Children are not afraid of it. They actually like it. And I could pinpoint a particular lobe versus shaking the entire body. So also that limits the amount of time that I'm kind of wasting. I could really focus in on a particular lobe. But this was a slide I wanted you to look at and see what other conditions the frequencer I have used with. And Mike, do you have any particular additions maybe to this slide?
Well, yes. When using the frequencer in general and setting it up for ventilator patients or non-vented patients, it's really simple. You have different intensities starting from your newborns, infants, preemies, up to your pediatrics and adults, going from less intensity to higher intensity. And then you have your frequency range, which is usually between the 37 and 42, but right now secretions, human airways is around 40 hertz is what we're going to use for our frequency range. When we're setting up on patients, really easy, just if they're awake and alert and can actually make noises themselves, you can easily have them just go ah, and as you're setting your intensity, you increase or decrease so that you have an effective sound that you can hear vibrating from their voice, but at the same time they're comfortable. And if they're on a ventilator, you would just look at your waveforms to see if you start seeing vibrations in your waveforms. And then when it comes to high frequency ventilators, this doesn't add to the intrathoracic pressures or anything, doesn't change your mean airway pressure. There's no risk of losing the airway with your preemies and micro preemies. You're on an oscillator or jet because you don't have to lift them up and try to get something around them or thumping them or like have more hands around them that should be just to do this therapy. So that's a little tidbit I want to throw in there. Thank you, Marcin.
Thank you, Michael. I think, again, in that particular aspect, Mike really gave a very interesting point, specifically when children are on those oscillators. It's high risk to move those patients. So any additional movement for them can potentially dislodge that tube, etc. But with the frequencer, I could utilize it in any position. The patient can be prone. They could be sidelined. They could be on their back. If you understand the mechanics of how that sound penetrates and how easily I could just move that sound head around the body, it could be limitless. I could really focus on one side of the lung, on a particular lobe, wherever it needs to go, with minimal impact on all these life-sustaining devices around the patient. And secondly, what Michael said too, it really is that sweet spot of that preset frequency of 40 hertz that a frequencer is at, but you play with the intensity, setting the intensity depending on our patient and what they can tolerate. So again, with our micro preemies and preemies, I would bring down that intensity pretty low and see what the child is able to tolerate. But through research, and there's quite a bit of research out there for the frequencer, the 40 hertz seems to be a really nice sweet spot for airway clearance. So here will be a few additional slides where I would like to share particular cases. First one involves abdominal wounds. So we have definitely probably some pain going on here. I had taken care of this little girl with TC7A immunodeficiency who had intestinal failure because of intestinal atresia, multiple abdominal openings, fistulas, etc. She arrived in our hospital due to respiratory issues. And of course, during my initial evaluation, I discussed what are certain things that they perform at home for airway clearance. Have they ever performed a formal airway clearance? And mom told me that yes, she was prescribed a vest and by the pulmonologist. But sadly, it sounded like there was no official discussion of other potential means or other airway clearance measures. She was just prescribed the vest, like, oh, you're having respiratory issues, let's just get the vest. But it seemed like not much was presented to her. And sadly, she also didn't get to test drive sort of this device before it was ordered. And it's just gathering dust at home. Mom was afraid to put her on her daughter. And even when she did put it on, at some of the lowest settings, she was unable to tolerate it. And you could imagine this, if we put on a jacket, which creates pressure because these vests do require pressure, wraps around, you increase the pressure and then it starts to shake. So it's a shear force. So shear force on abdominal wounds, openings like this little girl had, is going to be very uncomfortable. Causing her to not be compliant with therapy. As we heard, the machine was gathering dust. So once she started telling me this, I thought, hey, she's here for airway clearance. I know I have the frequencer, let me give it a try. So I did. And honestly, without surprise, I was able to perform full airway clearance with this girl over 10 minutes. She did not report any discomfort. She actually liked it. And I was able to, again, based on if we understand how the frequencer works and the sound waves penetrate inside of the body, I used it predominantly over her back while she was sitting. I could have even used it over her armpit region while she was in sideline. So incorporating postural drainage, changing her positions, and using the frequencer at the same time to really make it yet so much more effective while not causing any pain, any discomfort. She was able to be compliant with the entire airway clearance regimen during her admission at the hospital. So here we went from a patient who was non-compliant, unable to tolerate a device, to someone who actually enjoyed it. And she coughed up a nice amount of secretions. And now in my hospital, the doctors trust the frequencer pretty well. And sometimes now they even order it specifically under my chest physical therapy orders. They say, please bring frequencer, because they understand and see how effective it is with also such population as this girl was in. Next, a big component here, of course, are our premature babies in the NICU with respiratory distress. We have used the frequencer with numerous cases in the NICU. Of course, children, micropreemies, preemies at 25, 27, 28, etc. weeks have quite a few issues. A big one tends to be pulmonary hypertension. There are cardiac pathology issues. But we, as I stated before, need to bring in an airway clearance method that does not disturb these children more than it should. Because again, something as little as amount of light, individuals talking too loud in the NICU. Our nurses are highly protective of our NICU patients, and sometimes will quiet down the rounding team, but they understand that, and they like to be checked. But if we're already nervous about speaking and voices potentially affecting these patients, the devices that we use on them, we should be also sensitive to that. And performing manual chest PT can sometimes be a bit too much over sheer force, can be too irritating, and we cannot use the vest. They don't have tiny vests for 27 weekers. They don't have vests for 28 weekers. So we're really left with a small amount of interventions. But the frequencer has shined for us because of its sound, its low decibel output, how concentrated the sound is through the head. And there is a specific extension that the frequencer has for our NICU population. Again, I can pinpoint and limit the amount of stress on the patients. So if I don't have to do the entire lung field, I could focus in on that particular lobe that the doctor tells me to limit the exposure, but at the same time, really focus in without creating this whole body shock. But what we found, interesting enough, with the frequencer is that children like it. Kids in the NICU, preemies, I sometimes actually see them fall asleep or become more comfortable while I'm using the device prior to me coming into the room. So sometimes I might see a child who's being fussy, irritable. The nurse tells me, oh my God, Marcin, nothing was working. And she's happy to see me when I bring in the frequencer, because a lot of the time they know that at the same time I'm doing two things in one. We're doing airway clearance, which is effective. We do bring up a lot of stuff with these children, but at the same time, it's soothing. It's soothing to the patient. It's comfortable. It's safe. And again, it doesn't create that extra shock on our patients in the NICU, and really want to limit those negative exposures for our patients. Next example, I think this was a good big one, scoliosis repair. I see a lot of patients with scoliosis repairs, teenagers, and halo placement. So here I put down two examples. I had a 14-year-old female with spinal muscular atrophy, SMA, for scoliosis repair, and a 10-year-old with Marfan syndrome who had first a halo placed for traction, followed by, as she stayed in our hospital after the traction, she had the halo removed and then went on to have the scoliosis repair. So the issue with patients after surgery, such as spine surgery, is of course pain and installation of instrumentation into the body. And that critical period where the body's healing, the instrumentation is settling in the body. And we cannot really put all these external forces yet again on these patients due to a variety of reasons. Number one is I will create a lot more pain on them. B, I will be affecting the instrumentation, as that will cause more discomfort for the patient. So sometimes these patients, even if we roll them side to side, that can be excruciating, especially in the first few days where the pain team is trying to manage their pain regimen, pain medicine regimen. Sometimes I'm unable to even sit these patients up because that's how much in pain they are. And of course, they're at high risk of pneumonia. There are some of these patients with, again, like Marfan syndrome, SMA, they might be on a regimen of airway clearance at home. So we need to continue this regimen right after the surgery, and especially so in order to try to prevent other conditions from occurring. And that's where shear forces like manual chest PT will cause more pain, more discomfort. Slapping on a vest, I never put a vest on a patient after scoliosis repair. There were some residents that were asking, oh, Marcin, can we put the vest on? And immediately I say no. I would have to even have such low settings on the device, even if I did decide to, that it would really be ineffective. And manual chest PT, I try to stay away from as well because it's just so uncomfortable for these patients. But that's where I started to bring in the frequencers. I brought it in, put it over the chest wall. I'm specifically pinpointing the lungs, the lung fields, and I'm not affecting the instrumentation. So again, due to that fine zeroed in area of the sound field, we are not affecting the instrumentation and thus not creating more discomfort or pain for these patients. So we're creating effective airway clearance without increasing pain and without affecting the instrumentation. And I could utilize different size heads depending on the size of our patient, because of course, as I put the head on, I want to make sure there's a nice seal on the skin so that the sound waves properly transfer into the body. So yet again, another area where the frequencer can be used as a device to continue airway clearance after surgery, such as scoliosis and halo placement. So I would like to just finalize by saying the frequencer has its niche for airway clearance, where the other methods and other devices aren't able to go during cases like low, like thrombocytopenia, pain, sensitive patients on oscillators, multiple tubes, patients being on ECMO. The frequencer can, where before I would be unable to do manual chest PT or use a vest. Now I bring the frequencer with me, and the doctors, the attending doctors in my hospital know, and they started now just ordering, hey, Marcin, please bring that in because we know this patient can tolerate it and we need that airway clearance on this patient's staff. So that's a device now that can be in this niche. But at the same time, it can take care of all the other conditions that the rest of my other methods can as well. So be it cystic fibrosis, bronchiectasis, pneumonia. So that whole list that was there before and that the other current therapies are able to take care of, the frequencer can as well. So we have this duality here that we have a niche, but we also can use it for everything else. And with that, I'll head it over to Joanne to look at some potential questions.
Great. Thank you so much, Marcin. Thank you for the presentation. Very detailed and thorough. I do have some initial questions that have come in. The first I'd like to ask is around cardiac patients, Marcin. Do you have or have you used the frequencer on cardiac patients, patients with pacemakers? Are there any concerns? Does it have any interesting impact on heart rate even.
Sure. Good question. So first of all, anytime also that we perform any type of airway clearance with patients on telemetry, we always call telemetry, and we also, of course, report to the nurse so she knows or he knows that we are performing some sort of an intervention because there's always a possibility to dislodge some line, etc. However, I have used the frequencer with patients in the cardiac ICU, both pediatric and adult, with no real ill effects. I did not see any big changes. Again, what we have to think about here is because of the sort of that beam, the sound beam, that it's very concentrated, and I without affecting so much of the rest of the body, let's say as much as even vibrations from manual chest PT or the vest does, the frequencer is very concentrated without affecting other components of the body. And I've used it over patients' backs when they were sitting up. So I did use it on the left shoulder. So usually the pacemaker is placed here on the left anterior part of the chest without any ill effects or any crazy changes to the telemetry. Is there potentially some changes? Of course there are. But again, that's why I make sure always to talk to the nurse and to let telemetry know that I will be working with the patient, but nothing in terms of negative side effects to the use of the frequencer.
Okay, great. Thank you. Another question has come in around the frequencer being used in coordination with other devices. And I know you touched on it a tiny bit, but Mike, can we give some examples of how the frequencer can be used optimally with other devices?
Of course. I have just two case scenarios that would easily pull this in. You have devices that you're either pushing and pulling air in the lungs, trying to remove secretions, or you have devices that are shaking the chest wall to try to move air back and forth to shear secretions off. Well, sometimes all of that is a turbulent flow based system. And so if you have blockages, you have pneumonias, you have plugs, etc., you're not going to be able to get air into those spaces. The frequencer allows you to do is liquefy those secretions, allowing you to actually start manipulating those secretions then further. So two case scenarios, both chronic lung kids with trachs that are normally getting either cough assist vest or IPV cough assist, plug up, dehydrate somewhat, and now they're going downhill. You got a whole bunch of bag lavage and suctioning. You have following with the vest cough assist. Nothing's happening, and they're just going up on oxygen demand. Add the frequencer in just one session for a good 12 minutes. Following that, follow the cough assist, and everything just came pouring out afterwards, thus keeping the kid from escalating to the ICU, clearing everything, going back down on their oxygen demand. Same thing with the intrapulmonary percussive ventilator. Same exact kind of scenario, doing that Q2, Q1, trying to clear these secretions out of the kid and get air back in the lungs, throw the frequencer on for 12 minutes, and then follow with your intrapulmonary percussive ventilator. And everything just came pouring out during that treatment. And then we had got to de-escalate everything and keep that kid from heading to the ICU. So those are two case scenarios. I think they work perfectly hand in hand with each other. I think if you can get in there and you can liquefy those secretions, decrease the viscosity, help the cilia get back to a normal beat movement if they can, and then use devices that are meant to break and remove secretions and bring secretions up to the main bronchus and clear, is your best bet for an effective treatment and doing less treatments on a child or an adult. These kids are like adults. I just call them my kids.
Okay. Marcin, do you have anything else you'd like to add to what Mike just said, or would you like to move on to the next question?
I think that was a very good example. I think we can move on to the next.
All right, great. So what about any complications or limitations of other devices? Let's stay on devices for a minute. And complications or limitations on devices when used with high frequency oscillation. Is the frequencer appropriate for that?
Yes. Well, obviously, if we're using an oscillator, we're not using the adult world. Well, if you are using an adult world, then trying to get a vest on or trying to do anything else to manipulate the body, trying to do pronate, etc., while you're on a high frequency ventilator or any ventilator, makes it really impossible to go ahead and get in the position you properly want, and have airway clearance. The frequencer allows you to do whatever position they're in, give you the same effect that the vest is going to give you. And then you can suction, normal suction like you do already on these ventilators. So nothing changes in that point. But it, unlike the vest restricts the thoracic cavity, we put it on, strap it on, and you have to manipulate the patient. You have changes in your mean airway pressure, and you have changes in your settings. You cause your oscillator in a NICU or PICU or adult world to go crazy, possibly shutting down in those instances where the frequencer can go ahead and just do your treatment, whatever position they're in, without having to risk any of that happening or any side effects to your patients.
Okay, great. Thank you. Marcin, do you know of, or how would you describe what a respiratory care team looks like and what the roles of each member is when it comes to recommending a therapy, and that may or may not include a device?
Sure. So, for example, in my hospital, it's important to have an interdisciplinary team, which composes, of course, of the attending physician, fellows, head nurse, and other specialties such as respiratory therapists, physical therapists like me, social work, etc. And we all discuss the patients in the ICU. We go through the entire list. And of course, prior to that IDR, I scan through the patient list and see where I feel as a clinician a patient might benefit from airway clearance or physical therapy. And during the discussion, it's important for us to voice our opinion and say, oh, hey, maybe to the fellow, do you feel it might be good for us to go in there because of X, Y, and Z to do airway clearance? So I think it's important for us to become empowered and to create these suggestions to the rest of the team, so that over time, for example, like in my hospital, they already now know of the frequencer, and they directly ask for it. They say, oh, Marcin, can you bring the frequencer for this patient? And I said, hey, you read my mind, because again of that niche and the multi-use of it. But it's important for us to sometimes even speak up when maybe someone will say, oh, hey, maybe a resident will start and say, please bring the vest therapy for this patient under chest PT orders. And maybe, like, for example, with that girl who had the abdominal wounds, I don't feel comfortable with that, and I wouldn't really utilize that. And I think it's important for us to bring that up. And again, as long as you argue with reason, I think it's important to have these discussions, to have these talks, to find what's best for our patients, and to maybe suggest, hey, have you ever heard of the frequencer? It can be utilized on such a patient with abdominal wounds because of X, Y, and Z. So I think over time, as we show our attendings, our fellows, our own understanding as therapists of conditions and use of such devices as the frequencer, we could really create the best treatment protocol for our patients to maximize results.
Okay. So, we know that there's very few devices from an airway clearance perspective that can be used in the NICU. There are obviously other lung treatment devices in the NICU. But when it comes to airway clearance in the NICU, we've heard that maybe some small vibrators are used on the babies. Can you share if the vibrator is effective or not?
So yes, we have seen such devices. Actually, we even had family members sneak in sometimes small little massage vibrating devices, that you could get in stores or online. But there is a very particular device called the Percussor 5000, which we have seen being utilized in the NICU setting. Now, going back to where I was coming from previously, the big component here is the stress on these children. And this is, again, a shear force. So it's a vibrating device, external on the patient body. And that's something I, again, do not really want to cause to these micro preemies and preemies because it will disturb them. It will be a shocker. But that's one component of it. So already it's that external uncomfortable, shocking experience where a lot of these patients are very unstable. That's number one. Number two is for it to be kind of calmer, you have to set it to relatively low settings. And then we have to start asking ourselves, is this really effective? And from my own experience, I have not seen that device being effective, nor the ones that the parents bring, the vibrating devices, the massagers. It's not effective. Again, it's for that external use, the massager. That's not causing airway clearance. What we need is a device like the frequencer where it's penetrating, it's calm, it's low decibel output, but it's at the same time able to pinpoint into the lungs while not being an obnoxious stimulant for these children. So I would say those external vibrating devices are A, either not effective, or B, if you set them to high settings, they're just an obnoxious negative stimulant for these children.
Yeah, and to add to that, there's manual percussors that we use in the NICU. Obviously, you're beating on the chest of a preemie if you're trying to do that. How effective is that? And how long are we doing that for? And there's also studies showing if we have babies that are within an isolette, using high decibel devices within the isolette is causing a lot of babies to have hearing issues as they get older. So trying to minimize the actual decibel output of our devices that we're using within an isolette is obviously a must, and something that a lot of places are starting to push towards and move towards.
Okay, well, I'm going to end with one more question, but of the almost opposite in nature. It's for adults. We have heard some people say that if they don't feel that thump related to their device, then they don't feel like they're getting good therapy, or that thump from a clap. What are your thoughts around that? Does therapy have to be painful to be effective?
No, it does not. As we have, I always think of that commercial. If some of you remember, a grandfather with his grandson using a mouthwash, and he says, "Oh, if you feel it burn, then it's actually killing the bacteria." And that doesn't have to be the case, right? We have all these lovely other components now that are not painful and do the same job. So same thing with like manual chest PT. It doesn't have to be super loud for me to say, "Oh, that's effective." Actually, really what it points down to is the effective seal that I create on my hand. So the clapping doesn't have to be loud to be effective. So the frequencer in this case, what's happening here is, yes, you're not hearing it. It's not a concert speaker. It's not meant to be. So it doesn't have to be loud. Oh, I can really hear it. So it's really doing the job. What is great about it is that it is silent, that it is pretty quiet. It's very low decibel output. But what's happening here is, again, it's creating that concentrated beam of sound, as we might say, that penetrates the body and goes straight for the mucus without being obnoxious in sound, without being painful on our patient's body. So through research, and there's research on the frequencer out there, it shows that that frequency of 40 hertz is able to break down the mucus effectively. And I had patients where kids had a full whiteout condition, and I couldn't do manual chest PT because the ENT doctor said, due to the particular nature of the surgery, they even said it, "Please do not do manual chest PT or the vest." And what was I stuck with? Well, thank God I have the frequencer, and that's what I used. So already after a day of use, the next day, X-ray improved, the lung starting opening up. It was not an obnoxious sound. I didn't have to be using some concert speaker on this patient. I used the frequencer. So no, it doesn't have to be super loud for it to be effective or painful. So that's what I would say in this case.
And we completely missed an entire group of adults there, the extremely obese population. What vests and stuff do we have that's effective? This thing is effective at getting to their secretions, liquefying them and help them move them up the airway without having to try to strap 2 vests together, 2 wraps together, or MacGyver anything at all. It's very effective, and it's a whole population we treat that we can't do vest on at all.
Yes, I agree about that point. We have morbidly obese patients in our ICU. If, for example, now after recovering from COVID, for example, who you cannot put a vest on. It will not fit them. But here with the frequencer, again, I could specify the particular areas, and it can be utilized as an airway clearance method. So I agree with you, Michael.
All right, great. So just before I wrap, are there any final remarks that either of you would like to make? Are there anything that we didn't cover today that you want to address with the audience around conditions or contraindications, or just any final thoughts?
Sure. From me, I think I would say that it's a blessing we have the frequencer, because in a variety of situations, specifically those contraindications for other therapies, where we would be unable to help our patients, the frequencer allows us to perform airway clearance with these cases, specifically in the acute intensive care setting, effectively and pain-free. So I definitely encourage you all to look at the niche points that we pointed out during today's webinar to see where you can utilize this device in your setting, in your acute setting, to better treat your patients and help them along the way.
I'm a strong believer in having multiple tools in your toolbox. I mean, there's even those patients that you have that don't have any of the contraindications, and you go and start your therapy that you're used to doing on everybody that they just do not respond to. There's something else for that. You can at least try something else instead of, well, let's keep doing the therapy until we can get them out of here, or just keep watching them decline. I like having multiple tools in my toolbox because not everybody fits a picture that you want them to fit. And I like having the variety and ability to go ahead and combine things as well as do things solely on their own that I see fit for that patient population. And I love having that autonomy with the physicians and everything to change it up if I need to change it up, or go with, I think, what is best.
All right, thank you. I think that's a clear message that we end the webinar with, is the ability to recommend the right therapies and have the right tools for your patients to deliver the best patient care. So with that, thank you so much, both of you, Marcin and Michael, for all of your insights today. I'd also like to thank all of the participants who joined us today. If you have any additional questions following today's webinar, please don't hesitate to send them along. We can also put you in touch with a local representative to further your discussion. Today's webinar is also going to be available on the Dymedso YouTube channel. So thank you for joining us today, and we look forward to seeing you again. Enjoy your day.
Thank you.
Bye.